back to another exciting episode of MedSynapse podcast series. I'm Hetvi Shah, your host, and today we're diving into a fascinating topic in head and neck oncology, which is organ preservation in head and neck cancers. This is such a crucial area as it not only focuses on oncological control but also aims to improve patients' quality of life by preserving vital functions. And joining us today is an esteemed expert in this field, who is Dr. Bhavin Vadodriya, a renowned surgical oncologist with expertise in oral cancer surgeries, larynx cancer surgeries, and transoral robotic surgeries. Doctor is particularly known for his proficiency in minimally invasive techniques that help patients recover faster with less trauma. His extensive experience, along with his dedication to patient centric care, has made him a trusted name in head and neck oncology. And we're so thrilled to have him with us today. So, welcome, Doctor, and it is so great to have you here with us.
Thank you, Hetvi, and thanks, MedSynapse, for this opportunity to spread the knowledge regarding same. And thanks for the kind words.
So, to start with give an overview, how has the focus on organ preservation in head and neck surgery evolved over the years, and why is it so important?
So, listen, surgical outcome and parts were being popularized in 1900, early 20th century, when cancer was only managed by surgeons. So, initial goal was only to cure for a cancer without thinking about anything else, such as let us talk about head and neck cancer. So, goal will be only that you will be removed from cancer by cutting your tumor, and there will be no second thought about your proficiency or about your speaking ability, about your swallowing ability, and all. So, initial was only curing cancer without thinking about anything else. So, by persistently following up this patient, surgeons come to know that this patient has a severe problem regarding their facial appearance, regarding their ability to speak, regarding their ability to eat food. So, and regarding their ability to do work routinely in which they were previously doing, like their job or their household activities. So this was thought when surgeons and medical world got results of curing cancer. They got excellent results in oncology. So patients were living longer but with bad quality of life. So they thought about organ preservation, whether organ can be preserved without compromising oncological principles. Yeah.
Yes, that is actually rightly mentioned, especially functional preservation is very important. Now, what are the key challenges you face when trying to balance oncological control with organ preservation in these complex cases?
Yeah. So listen, head and neck region consists of oral cavity, nose, oropharynx, tongue, larynx, and thyroid. So these, and esophagus also, upper part of esophagus. So this oral cavity, which includes tongue and upper aerodigestive tract, such as trachea, larynx, and esophagus. These organs are essential for a three main points of life. I would say phonation, that means voice, respiration, to take breathe, and swallowing. Swallowing is also important to eat a food. So these three are major function of life to carry out life with quality. And whenever the patient develops head and neck cancer, all three of them or two of them or one of three got compromised. So idea of organ preservation is to retain or maintain these functions for the quality of life.
Yes, that sounds like a tough balancing act, but it actually really helps out a lot. Now, are there any advanced surgical techniques that have helped in organ preservation and that has made a significant impact in organ preservation in head and neck oncology?
So, as I told you earlier, in organ preservation strategy in cancer and in oncology, there will be always one major doubt that you are preserving organ without compromising the oncological principles, such as most commonly sought organ for organ preservation strategy in head and neck is larynx and oropharynx. So larynx is the voice box, which is originator of the voice, and whenever patient develop a laryngeal cancer, initial treatment for the same before 50 years was total laryngectomy, which lead to loss of voice. Although there are many voice rehabilitation strategies we have, it was very depressing for the patient to lose his voice and do a permanent tracheostomy and hole will be visible on a neck. So veteran affair group, this was a group of investigator which thought that if we preserve the larynx by not mutilating it by surgery, and if we give radiation of a certain dose to same, we will see whether larynx cancer can be cured or not. So extensive trials were happening in 90s, early 90s and late 90s, and there were 2 or 3 groups which conduct an excellent clinical trial and which saw excellent result in a stage 2, 3 and 1 cancer, that if you have a larynx cancer and it is stage 1, 2 or 3, there are high chances it will be cured without removing it by surgery, and it will be cured only by chemo and radiation. So this trial actually was the most important for organ preservation strategy in head and neck cancer, and patient of larynx cancer are getting cured up till now from radiation and chemotherapy only. And according to stage, there are very high chances, like 95% of the stage 1 will be cured only by radiation, 80% of the stage 2 will be cured, 75% of stage 3 will be cured, and still we have not got answer. But whenever the larynx cancer spread to thyroid cartilage, we cannot save it by radiation. The only cure is a surgery. So without compromising oncological principle, we cannot we cannot preserve organ. That is a myth. We can preserve the organ and also maintain oncological principles, such as, let us talk about the oropharynx. Oropharynx consists of soft palate, base of tongue. These two are the most important factor for the pharyngeal phases of swallow, where your food is propelled towards your food pipe. So whenever any region of this develop a cancer, patient will have a major swallowing disability, and which can lead to aspiration into larynx and aspiration pneumonia and all. So initially oropharynx were treated by mutilating surgeries such as mandibulotomy, and your oropharynx will be opened and patient will develop a fistula and very morbid surgery. He will not be able to swallow. There will be long-term tracheostomy dependence, long-term feeding tube dependence. Then investigator come to know that why not to cure the oropharyngeal cancer without surgery, such as larynx, and they got the good result. Still, concurrent chemo radiation is a treatment of choice for stage 2, 3, 4 oropharynx. Even in stage 4 oropharynx, concurrent chemo radiation. But by following this patient for up to 10 to 20 years, we came to know by giving an extensive dose of 66 grade to these pharyngeal muscles of soft palate, base of tongue and pharyngeal wall, such as constrictor, patient have an extensive radiation-induced fibrosis and long-term problem in swallowing and dysphagia as well as voice changes. So these lead to revisiting strategy in stage 1 of oropharyngeal cancer, such as 2 centimeter lesion in base of tongue, tonsil or soft palate. So problem for the surgeon in this area was the access. For the access, they had to do mandibulotomy. But by invention of Da Vinci Xi robot, surgeon took their instrument into oropharynx very nearly, and by the magnification of the robot and maneuverability of the robotic arm of 7-degree movement, we were able to excise the oropharyngeal lesion without morbidity. So for the stage 1 oropharyngeal cancer, transoral robotic surgery is the greatest invention for the organ preservation strategy. So
Yes.
not only surgery, but radiation can also do fibrosis and compromise the organ. So my point is, organ preservation strategy is not only to preserve organ. Organ preservation strategy is to preserve the functional organ. That organ should be functioning well.
Yes, that sounds amazing, doctor. And especially preserving the right amount with the right techniques is also important, I feel. Now, how do chemotherapy or radiation fit into this organ preservation, and what roles do neoadjuvant or adjuvant therapies play in organ preservation, and how do they complement surgery?
I think I extensively talk about two cancers, oropharynx and larynx. So oropharynx and laryngeal cancer has an established role of concurrent chemotherapy and radiotherapy. That means 66 gray of radiation into 33 fraction, and along with 6 dose of low dose cisplatin. So concurrent chemoradiation has an established role in these two cancers. But let's talk about neoadjuvant chemotherapy. So it is coming in a big way and also already established in a stage 4B oral cancers. So recently, Dr. Chalker and TMH Head and Neck Disease Management Group has published the result of phase 2 trial, which is known as a NSCT mandible trial. So in which, in the cancers such as tongue cancer or floor of mouth cancer, in which due to extensive paramandibular disease, one has to remove the mandible along with the teeth. But by giving neoadjuvant chemotherapy of 2 or 3 doses of TPF regimen, the paramandibular disease is regressed and you can save the mandible. So this is the one of the trial which is showing promising results in a phase 2, that if you give neoadjuvant, your mandible will be saved if it is not involved. So we will soon be getting results of phase 3 trial, which is ongoing in, it is now actually multicentric in India, and there are so many centers involved. So we will getting a good result after 4 or 5 years, I guess. So that is one of that. And chemotherapy has a borderline role for the neoadjuvant setting in a nasopharynx also. So if we give neoadjuvant, means induction chemotherapy, and if we after that we give concurrent chemoradiation, patient will have a better outcome. That is already published in New England Journal of Medicine by the Chinese group, because nasopharynx is more common in China's eastern China. That's why, because of their smoking habits like river smoking and all. And surgically also organ preservation is happening like anything. So yeah, in mutilating surgery should not be done and it should be replaced by concurrent chemoradiation. But also there is de-escalation in surgical treatment as well. Let's talk about the neck dissection. So initially, when in early 20th century, Cryle described the neck dissection, it was only radical neck dissection. So all tissue, lymph node, tissues and all tissue and non-lymphatic structures were removed, and it was known as radical neck dissection, such as spinal accessory nerves, sternocleidomastoid, IJV, and all lymph nodes were removed without thinking about anything else. So at that time, goal was only to achieve a cure of a cancer. But after the certain follow-up of the patient after 20 or 30 years, the young surgeons knew at that time that radical neck dissection is giving very great morbidity, such as shoulder dysfunction, facial edema due to the tie of edge, due to ligation of the IJV, as well as the SCM muscle removal, which gives an unsightly scar. So they published a study and knew about the pattern of lymphatic metastasis in oral cancer. There is a landmark paper about from the Jatin Shah about the same, that certain all cancer have a certain propensity towards the certain lymph nodes, such as oral cavity spreads only to level 1, 2, and 3. Larynx cancer spread to 2, 3, and 4. So after this paper, surgeons knew that all patient doesn't require radical neck dissection. If patient is N0, patient is not having any clinically positive lymph node, then selective lymph node dissection with preservation of all, such as sternocleidomastoid, IJVA, and spinal can be preserved. So from radical neck dissection, we have reached up to selective neck dissection with preservation of all organs. So neck dissection should not be morbid procedure. Another thing is transoral laser microsurgery. So uh, transoral laser microsurgery was introduced by this Steiner, Dr. Steiner from Germany. So for the stage 1 laryngeal cancer, patient has a very small lesion in the larynx. So at that time, there was same issue. Surgeon's instrument cannot reach the interior of larynx. So radiation was a treatment of choice. So by means of microscope and laser, CO2 laser, we can remove the stage 1 laryngeal cancer by means of laser only. And this patient doesn't require radiation at all. For the radiation, patient had to travel radiation center every day for the 1 month. And this patient can be cured in a single setting. So this was a huge boost for the organ preservation in laryngeal cancers. Still, I would say for the stage 1 laryngeal cancer, if we patient have a right indication, such as good mouth opening, no cervical spine disease, no anterior commissure growth, then transoral laser microlaryngeal surgery is a treatment of choice.
Yes, I think that is such some really truly promising therapies that have come into picture these days. Now, after surgery, how do you help patients recover functions like speech, swallowing, or breathing? Because this is so vital and functions that we need for during head and neck surgeries.
Yeah. So initially, I would say the surgeon was the center part of the cancer management, especially head and neck cancer. So surgeon was the captain of this team. But we all know that single Kohli or single Sharma cannot win us the World Cup. The whole team, including Mumra and Jadeja and all, win the World Cup. So we have come to know that to win a head and neck cancer, we need a team. So that team includes such as surgical oncologist, he might be captain, but he needs his team, such as medical oncologist to give neoadjuvant chemotherapy, radiotherapy, most important person for the organ preservation. Now my rehab team, they are doing an excellent job. And most important part of my rehab team is speech and swallow language therapies. I would say them as SLP. My SLP team is doing an excellent job to diagnose and treat swallowing disorders following the head and neck surgery, such as doing fluoroscopy and during functional evaluation of the endoscopy swallow examination in the patient. We will having a swallowing disability after the head neck cancer. They will ask the patient to some exercise. They will do electromagnetic stimulation of the swallowing muscle. So by introducing SLP in so early in postoperative management, my patient can be feeding and breathing tube free in any cancer in a less time than before. So one is that. Another one is physiotherapists. Physiotherapists play important role in head and neck surgery by doing oral, neck and shoulder exercises. So shoulder distension can occur even after selective neck dissection due to handling of a nerve root and all. So these guys are doing excellent job and they can start physiotherapy on by second day. We should not forget about nutrition. Nutrition plays an important role in a recovery of the head and neck cancer patient. So my dietitian plays a good role. They tailor the chart according to patient's need and provide a high protein diet and provide a diet according to their cultural belief and all, as well as psychologist. Cancer diagnosis is very traumatic for the patient. Their first question will be whether they will be cured by cancer or not. And for the head and neck cancer patient, this is very much psychologically traumatic. They will have a question that whether my face will be looking same or not. So for the composite resection surgery also, we do not put incision on the patient's face, and that technique is known as marsh, in which there will be no scar over patient's face and all oral cancer tumor will be removed from the neck incision. So this can create a uh, uh, great confidence to the patient without compromising their face. So let us not forget about my plastic and microvascular surgeons. They do an excellent reconstruction in form of a free fibula, bone for bone reconstruction, and free ART flap. So patient's face nearly looks similar than before, even if their mandible has been removed, even if their part of oral cavity has been removed. So they play an important role for the organ preservation. I think to preserve a facial appearance of the oral cancer surgery is also organ preservation surgery. So plastic surgeons are doing an amazing job.
Exactly, that is so important to preserve the right amount and not just the external appearance but the functionality of that organ preservation is necessary as well. Now, finally, can you tell us about a case where organ preservation significantly improved patient outcomes?
Yeah, definitely. So during recent incident, when the 55-year-old teacher came to me uh, for a recurrent early glottic cancer, such as early laryngeal cancer, recurrent by means of he had already taken a treatment for the glottic cancer by means of radiotherapy, and still they develop a lesion. This can happen in 2 to 5% of our cases, an unfortunate incidents. So uh, I have already mentioned about transoral laser microlaryngeal surgery. So that is a boon for this patient. And even if patient had taken the radiotherapy, we offered him a transoral laser microsurgery, and we were able to remove his whole cancer without compromising his function. So, and when he was at uh, when he was consulted by another hospital where TLM was not available, he was straight away advised the laryngectomy, and we at our center were able to cure it by the transoral laser microlaryngeal surgery. And after 6 months, he had nearly achieved his normal voice even after undergoing the radiotherapy and TLM. So this type of incidents in my real life create a huge boost to my confidence to preserve the organ. So these were the very nice to me actually, these incidents.
And now, as we conclude today's session, thank you so much, Dr. Bhavin, for sharing your expertise and insights on this crucial topic.
Thank you, Hetvi and MedSynapse for this opportunity, and I'm always available for the uh, questions regarding management of head and neck cancer for the early undergrad students or postgrad students as well as patients. So they can email me or they can find me in Google. And thank you, MedSynapse, once again, and Hetvi. Thank you.
Thank you so much. And let me tell you that your work is clearly making a huge impact on patient outcomes and quality of life. So, all the very best for what you're doing, and it is incredible. And finally, thanks to all our audiences for tuning into this episode of MedSynapse podcast series. And remember, if you're a healthcare professional who is eager to delve deeper into medical cases or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay aware and spread the right awareness. Thank you.